Great. Okay. Welcome. Let's call the meeting to order. It actually is May 16th, 2022. And please join us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Commissioner Chang will be here, will join us in a few minutes, and it does remind me of the time that my husband got the tractor stuck and I couldn't get around him in the snow. And I was shoveling snow and I came in, I remember I was like, bright red. But thank goodness my neighbor came over and fixed the tractor so that we could move it. Anyhow, first item on the agenda, Peter and Dave, would you like to join us and give us the update?
Good afternoon, Commissioners. Peter Russell, Senior Transportation Planner for Deschutes County. I have the privilege and honor to introduce Dave Thompson over there, the longtime BPAC, Bicycle Pedestrian Advisory Committee Chair, for those of you not up on your acronyms, BPAC for Deschutes County, and he's going to give BPAC's annual report to the board about what they've done over this last year, which has been a tremendous amount of activity and accomplishment. So with that, I'll turn it over to Dave.
Great.
Thank you, Peter. So for the record, I'm David Thompson, and I am Chair of your Bicycle and Pedestrian Advisory Committee. So
welcome.
I appreciate you taking the time to hear our update today. In your packet is a memorandum highlighting our work over the past, actually more like 15 months, and then a more detailed document that covers a lot of the conversations that were had in our meetings throughout the year in much more detail. I probably won't touch on everything in the memo, so if I miss anything that you're interested in, please ask, and I'm sure you will. I believe this is not the first time I've presented to you folks, so I think you generally understand what BPAC is here for and how we're set up, so I'll skip that. I will say we continue to have very strong membership, citizens from throughout the county who are very interested in improving bicycle and pedestrian transportation options throughout the county. So we've been fortunate in our recruiting and managing to continue to attract really solid people to participate. Accomplishments over the last, since last time we reported to you, which was, I think, as I said, about 15 months ago, we've continued to leverage our role as a focal point for communication across the county amongst all the different agencies and other groups for bicycle and pedestrian information, best practices, and accomplishments. We have a regular set of attendees from all of the major agencies in the county, as well as folks that are just interested in what's happening in their area. So that's probably a key focus of our meetings each month, is to facilitate that communication. And then we also work on specific focus areas. This year, or last year, really we transitioned from our focus of identifying how we could connect communities within Deschutes County, and both between the communities and also from the communities to recreational destinations. We kind of transitioned from that into taking that information and working with Deschutes County Planning and the Road Department on the TSP update that's currently in progress. So our goal there is to hopefully come out the other side of this update with a stronger focus on bicycle and pedestrian as valid transportation options throughout the county, as well as recreational, but really our focus has been on transportation side of that. We've had really good working relationship with county staff and also with Kittleson, the consultant on that project, and we're very, very hopeful that the end result is going to reflect that. And as we move forward, we certainly encourage you to support those goals when you start seeing drafts and thinking about it. So. Beyond that, we've continued, one of the big activities in the county has been the City of Bend's Go Bond, which is now starting to build out some major new infrastructure, and we think it's going to be a big boost for bicycle and pedestrian activity within the city. One of our members is also on the citizen committee overseeing the Go Bond implementation, so we've got good lines of communication there, and as opportunities come up for us to provide input on those projects, we're certainly conveying that through him to the committee. As I said, we're really excited about how that's playing out so far, and we'll continue to watch it over the next few years as it goes forward.
Question for that: is there kind of a standard bike lane width or sidewalk combo that is being implemented through the city of Bend, or do you find yourself advocating for specific segments?
I think it's going to be really segment by segment. So, for example, the Wilson Street, which is what's currently being worked on, as it went through early design, there were different options presented, and the committee, provided their input that a separated pathway was the best solution. Certainly, plenty of people within the city felt the same way. And
That's through the roundabout discussion. Is that what you're referring to?
well, we're actually talking about along the street, but
Okay.
the roundabout is always interesting. Roundabouts are very safe, but they can provide challenges, especially for bicyclists. So there has been a lot of discussion on that. Obviously, the BPAC is kind of a secondary advisor to the city, as opposed to, we officially report to you, and we certainly have lots of discussions with the city. But their Go Bond citizen committee is very focused on getting the best possible bicycle and pedestrian outcomes as well. So that's been a really good effort.
Well, that's a good concept to understand. So it's the countywide Bicycle Pedestrian Advisory Committee, so all roads. But you're kind of just a reference point for the city's committee, but you're still at the table also.
Yes, exactly. And historically, as I understand it, this is long before I even came to Deschutes County, I believe that BPAC started out as a city committee and then widened to become.
The committee probably wanted to be able to talk about the bigger picture.
Exactly. It's interesting that the city of Redmond actually has their own bicycle and pedestrian advisory committee, but the city of Bend does not. So,
Okay.
it's we do meet frequently with the City of Bend staff and talk about their projects, and they're always eager to listen to.
Is this the year of the electric bicycle also? I mean, it seems like they're advertised a lot more. We've seen them for a few years now, but there's just a lot more.
Yes,
excitement.
and when I talk about our future plans, electric bikes are one of the things that we really want to get more involved in the discussion on. There are obviously a lot of positives about electric bikes in terms of providing a transportation option that can get us towards where we need to be in terms of reducing carbon emissions. But on the flip side, there are some challenges as well. We've certainly heard from people who use the paths who are concerned about electric bikes, passing them at what seems like a high rate of speed when you're a pedestrian, and pretty much totally silently, so.
But even as an automotive driver, just driving a car, I remember over by Old Mill, it was kind of an uphill road. All of a sudden, there's this electric bike just right down and I mean, it was dangerous because as a driver, you wouldn't expect that kind of response from the electric bicycle. All of a sudden, it was right there.
Yes, that's definitely a challenge. As long as you brought it up, I might as well just
Sorry, yeah, just ideas.
cover it now.
Yep.
So, the committee believes that there's a lot of kind of uncertainty in the way electric bikes are currently regulated in the state, the county, the cities, and in the different jurisdictions like Bend Parks, Forest Service, BLM. They all have their own idea of how electric bikes should be treated. There is a categorization of electric bikes. I doubt very much if anybody who's bought an electric bike in Bend in the last 3 years could tell you what that categorization is and where they're allowed to ride it and where they aren't. And that's not even getting into how would you enforce saying this category of bike can't be in this place when you can't tell by looking, right? So anyway, we just think there's a huge number of questions, and we think it's going to continue to grow explosively. So we just want to get engaged and see if there's a place where BPAC can help bring some clarity perhaps to the conversation.
Mm-hmm.
It's a difficult subject, but I do enjoy seeing lots of kids who presumably would be getting driven to school by their parents out riding their bikes to school. That's great. So when they pass me on the sidewalk doing 20 miles an hour, when I got my dog, maybe not so much.
Mm-hmm.
So anyway, yes, we definitely are interested in that. The other item that I wanted to talk about in terms of activity, so in 2019, the county adopted a transportation safety action plan in conjunction with the Bend MPO, who did one in the same time frame, basically in parallel. There has been some activity over the past year at the COACT meetings in terms of ODOT funding a media outreach campaign for safer driving. And COACT has, I believe, formed a subcommittee to work on that. COACT has agreed to be the focal point for that across Central Oregon, and I think that's great. I'm still, I guess, a little underwhelmed at our ability to leverage that transportation safety action plan in really meaningful ways, and certainly know that it's difficult, right? We certainly, I think, are looking at it when we're looking at spending infrastructure dollars, saying, hey, here's an area where we could improve safety. I think the system-wide safety concerns that were identified in that document, which basically come down to distracted driving and impaired driving, really haven't been given a lot of focus, specifically coming out of the Transportation Safety Action Plan. And there's been a lot of challenges the last few years, and law enforcement certainly has their share. I don't believe law enforcement is the answer to all of our safety problems, but I'm not sure we've had enough conversation about transportation safety and how we can improve it system-wide as opposed to targeting, a specific intersection that's got a high crash incidence. So I don't know how we get from here to there, but I just bring it up at pretty much every meeting that I attend, that I think we haven't tapped into that as much as we could or maybe should to try and improve safety. When you get out into the county, you're relying on the good driving of the people around you to a large extent, whether you're in a car, or you're on a bike, or you're walking. So if we can come up with ways to improve that, we can save some lives, hopefully.
And are you particularly concerned about the safety of cyclists and pedestrians, or more broadly, you just the things that are laid out in the transportation safety action plan you want to see happen?
Well, my focus is on bicycles and pedestrians, and obviously they fare the worst in any crash situation. But the action plan calls it out for as a risk for drivers as well. I mean, inattentive and impaired driving is a huge contributor to the underlying causes of crashes in Deschutes County, and it's a tough problem, and I don't have any solutions to offer. So I just bringing it up because if we don't talk about it, we don't talk about it. So. Okay, moving on here. The BPAC Awards this year or actually last year when we put out our call for nominations for the Big Chainring Awards, we did not receive any nominations, and that's following the year before when we received a record number of nominations. So I don't know if the media blast that the county communications people sent out just hit on the wrong day of the week, or if the ATZB and the Ben Bolton had other things on their plate that day or whatever. But so we have no awards to present this year, unfortunately. And the Safe Sidewalk Awards, generally we don't put out a call for nominations unless we have some significant snow events. And this year we had one early, and then we really had nothing after that. So we skipped those this year. Hopefully next year we'll be able to hand out some awards. It would have been great to do it in person this year if we'd got some nominations. I don't think that it's for lack of people doing good work out there, but we just didn't manage to stir up the nomination process, and we'll work harder on that. Okay, talk just briefly about our future focus. We kind of covered the e-bike issue, and again, the BPAC doesn't have a position on e-bikes in any way, shape, or form at this point. We're just asking questions and trying to figure out where we could potentially help figure this thing out. We are advocating for this community connectivity, and that connectivity is going to run across multiple jurisdictions. The path that's currently in the planning process from South Bend down to Lava Butte and connecting to Sun River is a perfect example. I mean, it's a lot of it's on Forest Service land, which doesn't allow e-bikes theoretically. So, but you've got a paved path that's perfect for somebody who wants to commute from Bend to Sun River, or vice versa. How do we pull all that together and get to somewhere that makes sense for everybody? That's what we'd like to work on.
I have a question. Does BLM allow them on BLM property?
BLM, my understanding is BLM currently allows e-bikes on roads, double track paths in some cases, but not specifically on single track paths. So I believe the BLM was working on an update to their policy, but to be honest, I don't have any real information on that. And again, somehow I suspect they're not consulting with the Forest Service or the state of Oregon as they come up with these. Each jurisdiction's kind of doing their own thing to a certain extent, and there's only so much that locally we can do to influence that. But we certainly believe a coordinated effort would be good.
Well, as this topic comes around, maybe think of the board, just a session like this, a future agenda item. Doesn't even need to be long, on the topic of e-bikes or, battery-powered. This is what we know, and this is what BPAC would like to advocate for. So it isn't an afternoon session, but it would be an agenda item at one of our board meetings, and if my fellow commissioners would support that. But, because then we would all be in the know. And there's just a point in time in the future where, if Forest Service or BLM make a choice, we can help propagate the information here or advocate for or against something.
Good, good. No, we'll definitely put that on our to-do list, and, I imagine, I'm sure it's going to take us a few months to get to a point where
Oh,
we
yeah,
can do
anytime,
that.
6 months and even the TSP, I'm sure there's going to be at least a little analysis. I don't know if there'll be a policy or whatever, but, as soon as the TSP comes around, being up to speed on how fast electric bikes go, or where they can go.
Yeah, it would be really helpful to have some kind of a visual or chart on, the different classes of e-bike and where they are and aren't allowed. And,
Yeah.
I think some of the more powerful e-bikes, you're not even allowed to have them until you're 16 or 18 years old or something like that, so.
Yes, there are certainly a lot of kids riding e-bikes to school that Oregon law does not permit. And I don't think we want to run out and tell them they can't do that either.
No,
But it just highlights the problem, right?
yeah, no,
Or acknowledging that it's a safety issue or,
Yeah.
what's going on there.
Okay, yeah, thank you, and we will definitely come back and brief you guys as we get a better handle on where we think we ought to be going.
Mhm.
And
Second
you might want to
item
do the
that-
same thing at a COAC meeting in the future, too. That would be great to bring it there.
That's a good idea.
Yes, I would appreciate that.
or we could figure out what's the best venue to do one big forum and various of us could go to that, because,
Well, and we're also planning to have a Central Oregon Bicycle and Pedestrian Summit this year since we've missed the last 2 years. And that would be, I think, an excellent topic there, where we tend to have transportation folks from around the region. So maybe we can have a discussion there as well. The second item the committee voted to focus on going forward is to improve our effectiveness at influencing transportation project planning. I think we actually have had a lot of success in that, but what really brought this up is the North Corridor project, and it was kind of a unique project in that it was planned a long time ago, and then there was no money, and it kind of sat, and then all of a sudden there was money, but the environmental statement had already been done, and so there was a limit to what could be changed. So we ended up with a project that's got a fair amount of bike ped improvements in it, but it also missed out on some key connectivity areas. So we've kind of got a project that inside of the project, good bike ped connecting to the neighborhoods outside the project. Maybe we've made things worse. We certainly haven't made it better. And people on the committee were kind of frustrated by where we ended up on that. So the goal is to get involved earlier, which in this case would have been a long time ago. And talking to a previous member on the committee, Rick Root, who some of you may know, he said, "Hey, I raised my hand way back in." But again, the committee feels we can do a better job if we make sure that we get in on the ground floor when projects are being planned, because you just never know how the funding's going to play out, when they're suddenly going to come to life, and you want to make sure you've done as much as you can to optimize the project before that happens. It's hard to change it once the money's in place. So we're going to work on that. Definitely want on those projects to focus on making sure that whatever is newly built or rebuilt in terms of roads improves connectivity for pedestrians and cyclists and doesn't create new barriers. And I think in general we do pretty good at that, but we want to stay focused. Not sure how we're going to measure our effectiveness there yet, but it's something we do want to focus on. And finally, and as part of that, we'd like to do a better job, and Commissioner Dare, you've already mentioned this, at coming to you folks more often and saying, hey, we're looking at this project, and we'd just like to point these things out, and if you get involved, you might think about those when you're having discussions. So we're going to try and be better at bringing you information early on in the project planning cycle, so that if there's issues or concerns, you'll be able to decide if you want to try and influence the results.
And I would just say alongside that, if there are things you need us to be doing to support the BPAC to accomplish your goals, more regular interaction and just sharing those things with us would be great. I'd be interested in hearing them.
Thank you, and yes, we realize we haven't, typically we've only been here to talk to you once a year, and I think there are opportunities to do a better job at getting you information so that you can act accordingly, and we're going to work on that. Finally, the committee, I think over the years, has felt that while one of our roles is to kind of represent community interests when we're working on things like project planning, we don't have a real good way of knowing what that interest is other than our membership, which is pretty representative and gives us, I think, a good starting point. But we would like to work on ways to get a better feel for how the community, where the community feels there are issues or what they think about e-bike issues and those kind of things. We don't know what the answer to that is. Obviously, our role is not to go out and run community surveys and that kind of thing, but we would just like to figure out how to tap a little more into other people's knowledge and interests in bicycle and pedestrian transportation in the county, and we're going to try and come up with some ways to do that. Probably be another good opportunity for us to come back and kind of update you on what we're thinking before we jump into anything. Having a Central Oregon Bicycle and Pedestrian Summit this year, that's always a good way, because we do get people that come to those summits and raise their hand and say, hey, I'm concerned about bikes passing me on pedestrian paths already, and now you're talking about making them part of the network. So it's really good to hear those things from people, and we'd like to figure out how to do a little more of that.
So Dave, do you have dates for that summit?
We're currently looking, I believe, near the end of August. I don't have the date right in front of me, Commissioner, but I'll get that to you.
Okay, that would be great. Then we could, get it on the county calendar and just, establish more attention for it, especially since we've missed a couple years.
Yeah, we also have not chosen a location yet. We had the last one we had was here in Bend, which was a first. It was established originally when, as I understand it, the summit was established when BPAC was kind of appointed to represent BikePed across all three counties at COACT. And in return, BPAC was tasked with holding these, then called the Tri-County Summits, to make sure we were getting input from people in all three counties. So my guess this year is we will not be holding it in Bend. I don't know where it's going to be yet, but we'll be figuring that out here pretty quick, and I'll let you know.
Okay.
Okay, and finally, on our to-do list is basically just to support bike share anywhere that it pops up. We think bike share is a very good way to improve our ability to get especially visitors around, but also our own population who may not own a car. And, you know, the new dockless bike share that they're working on bringing to Bend, we think will be great, and we're certainly will be out supporting anybody else who decides they want to try and do that. I don't think, unfortunately, it's probably not a solution to a county problem so much as it is city problems, but we think it's a great thing. Scooter share now is a different question, and I'm sure that's going to start coming up as well, and already has. There seems to be more of a concern about negative effects for scooter share than there is for bike share. And I was recently in Ogden where they have at least 3 different vendors with scooters on the street, and it was great to see them neatly parked in front of places you would want to pick up a scooter and ride away from. Not so great to see them tossed in the creek and left laying in the middle of the sidewalks. So, you know, I think there's going to be some pretty good discussion about that before we bring it to anywhere in Central Oregon. But it's a great way to get around. It just has some potential downsides, sort of like e-bikes. So.
Do you have to wear a helmet when you ride a scooter?
I don't know. I didn't do it, to be honest. I don't think I have enough coordination to ride a scooter.
Oh, I'm
Yeah, but no, I don't.
haven't you golfed with
Just
one
like
of those?
riding a bike. We saw that in Washington DC when we were there. There were scooters all over, and
Yeah.
it was good when you saw a couple people just getting from point A to point B. But just like you say, sometimes there was like little piles of them on the street corner, just laying on each other too.
Yeah.
So there's different scenarios there.
So I do know that the folks that are working out of the city Bend have said that, you know, if they were to propose that, it would be with solutions to those problems in mind, rather than waiting to see what happened and then trying to fix it. So that is basically the end of my presentation today. If there are any other questions, I'd be happy to try and answer them.
Well, thank you so much for coming in. I'm sorry that it's been over a year. And, you know, considering what you're doing, maybe we should plan this for every 6 months. Maybe that would be more relevant to what's really going on, so you can get ahead of things when you need to.
Well, when the chain ring awards were happening, or the
Yeah.
Safe Sidewalks Awards, we were seeing you a little bit more. So it's just, I think maybe COVID slowed us down a little here, but there'll be a moment in time we'll come back.
Well, and I didn't mention, but we had our first in-person meeting in over 2 years in Sisters last week. So it was really nice to actually see some people, and I think conversations just happen better in that environment, right? And one of the big things we like to do is start conversations between people from Agency A and Agency B. So it'll be good to get back to more of an in-person focus.
I know, we really didn't stop having our meetings, at least with the 3 of us in person. So truly it's much more conducive to getting a few things done.
And the last thing I would like to say is I appreciate Peter coming and introducing me today, but Tanya Salzman, who's our liaison to the county, has just been awesome. And she has been such a huge help to us in helping us figure out how to get things done and supporting us through the whole Zoom thing. So just wanted to pass that along.
That's really nice of you to say. Yes, Tanya is amazing. She's working on our wildlife count, I think, right now. So,
So
wonderful employee.
yeah, I just wanted to say that your activities list is really comprehensive. And, as I was diving into this staff report, I just kept thinking, specific projects kept popping into my head. Oh, Baker Road interchange. Oh, that's in there. And 4606 Road. Oh, that's in there. Canal piping projects. Oh, that's it. So, thank you to the BPAC for tracking all these things and constantly looking for opportunities to advance bike and pedestrian mobility and accessibility. And again, if there are things that the Board of Commissioners can or should be doing to support your work to advance those goals, I would very much like to hear about them.
Thank you.
Thank you.
Have a great day.
Thank you. Thank you, Dave. Thank you, Peter. Okay, we have item number 2. I believe Kara? Cheryl's in the room. Hi. Hello, good afternoon. Welcome, Kara.
Hi. Good morning.
And there's Janice.
Afternoon.
Okay.
Good afternoon, Commissioners. For the record, Janice Garceau here, Director of Behavioral Health for Deschutes County. Kara and I had intended to come in person, but I botched the plan by being sick this morning. So I decided to participate via Zoom. Apologies. I'd like to introduce my colleague, Kara. I'll let her tell you briefly a little bit about herself, and then we'll get started.
For the record, Kara Cronin, Deschutes County Behavioral Health Intensive Adult Program Manager. Hi again.
Good afternoon, Kara. Thank you for joining us.
Commissioners, we are here at your request. A couple of months ago, when we were presenting some information about one of our contracts, we talked a bit about the current state of affairs in terms of residential treatment beds for individuals who are experiencing behavioral health conditions, and you asked for a sort of status update. So we've put some information together for you. We have a PowerPoint that we shared. However, again, at the time that we shared it, we had intended to be in person, so it's all animated, and I don't know if that's going to drive folks to distraction trying to play it. So I will let your staff decide how they want to navigate the PowerPoint.
Okay.
Is it available?
I think so. Stephanie, how are we doing? Stephanie doesn't have it.
Did she just send it?
Okay, we're working on that, right?
Sharon might be able to do it too.
There was a PowerPoint in the materials that's in the packet, the PDF.
We have that, yes.
Yeah, okay, we can just work from that. I just don't know if you want participants to be able to see on the screen.
Okay, Sharon, okay, can you share screen with it, Janice?
I sure can.
But were you saying that you were concerned that there was
there.
like
Okay.
animation or things like that in here?
Yeah, I'm going to just use the PDF handout because I think that will be simpler for the purpose of this group. So I think everyone can see my screen.
Yes, we can.
Okay. So, Kara, I'm turning it over to you, and you just let me know when you want me to advance.
Great. Well, we're here to talk about residential treatment services. So, what is residential treatment? It is facilities of varying sizes that provide room and board and varying levels of treatment for people with a diagnosed qualifying mental illness. It's primarily for people with serious and persistent mental illness. Today, we're just going to be talking about the adult spectrum, I believe, Janice. I'm a little less familiar with our child spectrum. So residential treatment are 24-hour on-site skilled staff, as I mentioned, primarily serious and persistently mentally ill are served there. We're going to go through the 4 different levels of support that are available to our clients. And just want to let you know that these services are billed by the facilities to Medicaid. And our relationship with them is that we contract with entities that provide these services, room and board, in these homes or facilities. Janice?
We will talk a little bit about the child array towards the end when we talk about community planning. Any questions about this information before I move forward?
Maybe one question I have before we get started is, so this is an entirely, well, I'm trying to figure out whether this is an entirely separate world from substance use disorder treatment facilities, or whether there's any overlap, or whether there's people who go back and forth in some cases between substance treatment and these kinds of residential treatment facilities.
Yeah, great question. There are some co-occurring facilities in this state. We don't have any in Deschutes County, but those do exist. Those pretty few and far between. In general, these are really separate from the 28-day inpatient substance use disorder treatment. These are longer-term stays, often in the 2-year range, where obviously substance use residential treatment is a pretty quick stay. And they do have different funding streams. These are funded through behavioral health Medicaid billings. SUD treatment providers like Best Care are billing the alcohol and drug Medicaid.
Commissioner, you've hit on something that can be a barrier for our clients. Many people with serious and persistent mental illness also have co-occurring substance use disorders. And we've certainly had the experience of trying to place individuals in a residential behavioral health setting when the setting says, well, we really want their substance use disorder to be treated first, and vice versa. We've had substance use disorder treatment settings say, gee, we're really not prepared to fully respond to the mental health needs of the individual. This is a barrier that I think at the state level and even at the federal level, there's growing awareness around and some policy changes on the horizon with respect to entities certified to provide co-occurring treatment. What we experience in our world is that many of our clients have both chemical dependency and mental illness as a presenting problem, and they feed into each other. And when we work in a system that insists on treating them separately, our clients often are not as well served. So I appreciate the question. Anything else on this slide? We have 8 content slides just for a time check.
Okay.
So as I mentioned, there are 4 levels of behavioral health residential treatment. These are going from the least, I would say least acute to most acute. So adult foster homes provide room and board, 24-hour staff, and support with activities of daily living, like daily tasks, laundry, cooking, meals, medication. But they don't provide any other on-site treatment.
Is there a limit to how many
and-
people can be in an adult foster home in Oregon?
Yeah, it's generally 5.
5?
Yeah, and there's a certain licensing of the home, square footage. I've never seen one more than 5.
Okay, where they have to have smoke alarms going off every 90 days, they have to have sprinkler systems in them, all those kind of things, you mean?
Those sorts of things, and yeah, I believe the licensing is up to 5. I've never seen one less than 5 either. So.
Okay.
Residential treatment homes. So this is a higher level of behavioral health treatment. They're doing all of the same things as an adult foster home, but they are also doing on-site treatment like case management, skills training groups. And these are, in ASHs, it's very limited staff training. In residential treatment homes, you have paraprofessional staff, so normally bachelor's level or associate's level trained staff. An RTS, we don't have an RTS in Deschutes County, but there are many across the state. It is a non-locked facility. It does all of the same things as the other two, but employs professional staff. So they have QMHPs on site, which is a master's level clinician, and they have a higher staffing ratio. These facilities are generally 16-bed facilities, non-locked. And then SRTS, a secure residential treatment facility. This is like our DRC. It's a locked facility. They provide all treatment on site. So they have psychiatry, they have nursing support, skills training, therapy, groups. All of the treatment needs of the individuals are provided by the facility. And quite a high staffing ratio for clients to staff.
And the DRC is the Deschutes Recovery Center. That's the facility that's on the public safety campus in Deschutes County.
That's with 16 beds, and it's the locked facility, correct?
Yes.
Correct.
So the residential treatment facilities, you say there are none here. You're referring to Central Oregon, Crook and Jefferson County too?
Yeah.
And do you have a map of where they are located in the state? Kara, could you share that with us
I
later?
could, yeah, for sure. Let me work on that for you.
Okay, but
Are you
those,
interested-
are they limited to 16 beds in each one of them?
RTS are 16 beds. I think they can be less. Most providers, there's a break-even point of where it can self-sustain, and 16 beds is sort of the break-even point. If they have less beds, it's hard to sustain, fiscally, financially.
Okay, and so the teenage facility, Rimrocks in Prineville, that wouldn't be in that category because it's for teenagers?
It's a substance use disorder treatment facility.
Okay, it's for substance use.
Rules apply. Yeah.
Okay, thank you.
Can you say again what DRC stands for?
Deschutes Recovery Center. It's over right by 911, behind juvenile.
And the county doesn't have any involvement with the facilities for that, like the capital, like the building and, or that kind of interface with that project?
We have
We do.
quite a lot. I believe we own the
think we
land.
do
in
the building.
and
We do the building.
we lease it to to Telecare, who is the treatment provider. So we do own that building.
Got it. Thank you.
So here's our current state in Deschutes County. We have 41 beds. 3 are adult foster homes, so 15 beds. We have 2 RTH homes with a total of 10 beds, and 1 SRTF, secure residential treatment facility, with 16 beds. And that, so secure residential treatment facility, DRC, 8 of those beds are dedicated to Psychiatric Security Review Board clients, which has a little bit of its own separate rules, but those are people who have pled guilty but for insanity and are tracked through treatment options versus prison options. So in 2018, we lost a 5-bed residential treatment home that served PSRB clients. The PSRB rates the reimbursement rates had dropped, and the provider couldn't make it fiscally viable anymore. So the result of that is that we have less of a flow for our PSRB clients. They are now being routed to our other beds. So a real loss for us in 2018. And also longer stays, sorry, yeah. They have longer stays in our secure 16-bed facility, which makes less capacity for civil commitments or other acute client needs, including aid and assist.
And commissioners, you'll recall from previous presentations, especially during the budget cycle, we have lost beds at the same time that our population has increased about 23% in the last few years, and state hospital beds that are available for individuals who require civil commitments to hospital level care have virtually disappeared. So this reduction of beds in our community is exacerbated by the larger reductions in access at the state level, the increasing acuity of the people that we're serving, and the growth in our local population. All of those have come together to create a real crisis of care, frankly, for people who need this level of care. So I'll stop there.
And Janice, when you said a 23% increase in our population, are you talking about our overall population for the county, or are you talking the SPMI population?
The overall population.
Do we have a sense of whether the SPMI population tracks with the general population?
SPMI, so when we talk about SPMI in this context, we're talking about people with serious and persistent mental illness, but particularly people with psychotic disorders or bipolar disorder, or on occasion severe depression. But typically we're talking about people with an SPMI diagnosis in the realm of diagnoses that are often accompanied by psychosis and significant impairment in functioning. And the reason I'm saying that is because, for example, complex post-traumatic stress disorder is considered an SPMI diagnosis, but that's not the population that we typically serve in these facilities. The population of people with SPMI diagnoses that have psychosis as an underlying primary symptom remains stable over time. So it's somewhere between 1% and 2% historically for as long as we've been able to have a clear diagnostic category and tracked the prevalence in the community. So as our population increases, these individuals increase at that same rate, roughly, in the general population.
Okay.
That was a long answer, but.
So 1% to 2% of a growing population is a growing population of SPMI diagnosis people.
Of people with SPMI diagnoses and psychosis as a co-occurring set of symptoms. Psychotic disorders typically are the folks who are most impacted and struggle to live independently or without additional supports or resources.
Okay, thank you.
Yeah.
Any other questions before we move on to this slide? All right, well, our responsibility as the CMHP in the residential treatment spectrum. So we have a position that's dedicated to coordinating placements and wait lists for these 41 beds. We monitor and facilitate discharges and step downs between facilities, like from the state hospitals to other facilities and into the community. We provide all of the treatment services for people in the adult foster homes. So they have meals, some activities, and room and board at their home, but they're coming to our clinics, or we're going out to them to provide treatment services to them. The RTH, we sort of split treatment services. So the RTH facility does some of them, but they're often coming into our facility for medication management, psychiatry, nursing, groups, therapy, and a lot of care coordination. So we take over all of the services when people are discharged from these facilities. So when someone graduates, let's say, they're coming to outpatient care to receive all of their care needs. And we do the contracting with these providers. So Telecare, I mentioned earlier, is someone that we contract with. So we do a fair amount of administrative back-end work to make those contracts happen and to facilitate the pass-through money for indigent clients. And we always provide crisis services to everybody in the community, but to these residential facilities as well.
So if I could try and just parse this up a little bit to make sure I understand the populations and subpopulations we're talking about, is Deschutes County Behavioral Health responsible for everyone who has psychosis or SPMI within our county, or only people who are on Oregon Health Plan, or kind of like a people with less resources? So that's my first question.
Yeah, though those two things are the same often, right? So we don't have a lot of very wealthy people with psychotic disorders. There are probably a few out there that we don't provide treatment to, but the vast majority are our responsibility just by the nature of the severity of their illness, and they often qualify for Oregon Health Plan.
Okay.
And commissioners, just to, again, connect this back to some of the information that you get in the budget presentation, this really represents what Kara is talking about, and your question, Commissioner Chang, really represents when we use the term core services and safety net services, which we're obligated to provide. That's really what we're talking about. We're talking about the kinds of services to individuals who are either on the Oregon Health Plan or who, regardless, without us, would not find these services elsewhere. So many of these individuals, in fact, are on Medicare, which is a huge problem for us in terms of reimbursement. Medicare does not reimburse many of the wraparound supports and services that the Medicaid OHP does. So regardless of payer, our role as a CMHP, and it's spelled out in statute, frankly, is that we're the safety net for these individuals in the community. So in a sense, the short answer to your question is, at the end of the day, for people who really can't be served elsewhere, yes, we are it. We are responsible for ensuring that these folks have access to services.
Okay.
And this group of folks need a different type of treatment than going to therapy once a week at someone's office. So we are out in the community all of the time with these clients, meeting them where they are, doing a lot of care coordination, helping them get medical care, helping them navigate, the world and their lives. So it's a different way of providing treatment than that I might go to, right? I might not need all of those wraparound services. Depends on the week. But
yeah, high acuity. I get. I'm tracking. So then, I'm trying to understand the organizations who run these facilities. Basically, is all of their revenue flow to run those facilities coming through Deschutes County, or is there, are there revenue streams that are external to our relationship with them?
yeah, so let's say Telecare, they're billing directly to Medicaid. So they're billing people's insurance. Sometimes we have indigent clients, so they might be indigent. Occasionally we have an undocumented person who is in one of these facilities that we're required to care for. And we do pass through some money from the state for those individuals, but by and large, the facilities and treatment providers are billing directly the person's insurance.
Okay, thank you.
And that is a change. Historically, a lot of those dollars pass through counties, and the OHA and the state made a change several years ago to allow providers to directly bill Medicaid, and they just pass the indigent dollars through the counties now.
Got it. Thank you.
And I'll just add, not just undocumented citizens, like Medicare, people with Medicare only are considered indigent in this regard.
Yeah. So indigent is defined as uninsured or underinsured in the language of the contracts. So we're going to shift gears a little bit and talk about what we are doing, what some of the impacts of the critical gaps have been, and then what we're doing to address it. I think Kara has really foreshadowed this, but basically the bottom line is there's an inadequate number of placements to meet the current needs. And we're seeing the results in our community, and you certainly have heard about those results in various settings and in various ways. We are treating acutely ill individuals without the kinds of structures that we would really ideally want to be able to rely on. So we're often providing services to them in their home or in a motel, a shelter, a homeless camp, trying to provide literally hospital level support to an individual who's very inadequately housed. What we're seeing is that individuals recycle through acute care settings like the emergency department or the state hospital or jail. We are seeing longer stays in acute care settings such as Sageview or Brooks Respite, oftentimes because people have just become a lot more ill by the time they're able to access a bed, or because where they really should be served is the state hospital and they're being served in settings that were designed more to be 30 to 60 to 90 day offerings like Brooks. There's difficulty increasing to the appropriate level of support for people who are decompensating in the community. We're having to hunt folks down, find them, engage them in some really unique and innovative ways to try to get to them before their symptoms have become so dire that they're really not able to engage in care. This has definitely shown up in an increased burden on clinical teams, our crisis teams, our intensive teams, law enforcement, and the acute care setting. And it's certainly increased the level of acuity of clients that we're treating, even in our outpatient services, which historically treated a lower level need individual. So the whole system is taxed. The ever increasing number of aid and assist individuals taking state hospital beds is a factor. They also take some of our local residential beds. So Kara mentioned our secure residential treatment facility, the Deschutes Recovery Center. Some of those beds are dedicated to individuals who were committed by reason of an insanity plea, but they're also often taken by people on an aid and assist civil commitment. So it's just a narrowing of what's available for others in the community who have the need of higher level care. And finally, since COVID and the staff impacts that have resulted since COVID, we're finding that residential treatment providers are having an incredibly difficult time keeping staff on board to work with this really difficult population. So staffing has been a complicating factor. And let me just pause there and see if there are other questions. Okay. So what are we doing now? We, as you know, and have been involved in for several years, we've worked steadily to implement the Deschutes Crisis Stabilization Center, improve on our MCAT response, and just enhance crisis response overall. We utilize intensive teams to highlight and address housing instability and intensive supports. So we have our intensive teams have really developed models that are much more community-based, often have just increased their connection to community-based organizations that serve unhoused individuals. We do a lot of work with basic needs entities, and we've staffed up our teams to increase peer support specialists and case managers to ensure that we have adequate resource to do the kinds of wraparound supports that you need for this service population. Several years ago, Molly Wells Darling was involved, and Kara has since carried the torch in standing up a forensic Forensic Assertive Community Treatment Team. It is not a Fidelity Act team, but it has many components of assertive community treatment. And it's specifically focused on the forensic population to provide increased capacity to focus on our aid and assist population. So again, intensive supports to people who are on an aid and assist civil commitment. That has helped us increase our capacity to coordinate with the Oregon State Hospital on discharge planning, and we do a nice job in our county per Disability Rights Oregon of managing that population really well. And we're exploring options now for expanding capacity in the region through a couple of funding opportunities that I've talked with you about before. And we'll talk with you again.
So, Janice, how many beds
yeah.
do you have a contract with Bethlehem Inn? I was just wondering.
Sarah, do you know the total number of beds we've contracted?
We have 3 beds now, but hopefully we'll be adding an additional bed if our grant is approved by the state.
Okay, so 3 beds in the one in Bend. What about anything in Redmond?
Not currently.
Nothing in Redmond?
And can I just ask, are those, are those beds, integrated with the rest of the Bethlehem Inn, or is it like a, you have one room or like a separate area?
They're dispersed. They really like to match people with people. Sometimes they might be together if that matches right, but sometimes having, acutely mentally ill clients together might not work.
Yeah.
So they're dispersed, and we go out and wrap services around them. Otherwise, they'd be houseless. They would be in the wind. They'd be very hard to find.
Yeah. So, Commissioner Chang, these are not treatment beds. These are safe places for a person to be while we try to support them.
Got it.
And very different from a treatment bed where you have trained staff and typically either individual or smaller shared spaces and facilities that are designed to ensure that people can be safely housed and managed in a congregate setting. So not ideal, but it's been helpful for us to stabilize some individuals long enough to get them connected to care.
It's been really helpful and a far better model than previously, paying for motel rooms.
Yeah.
This is a much better model. It's, staffed 24 hours. There is some oversight, whereas motel rooms are not great support.
No.
Yeah. One of the reasons I'm curious about that particular partnership arrangement is, and now also thinking about the Deschutes Recovery Center, like I'm wondering if it's a good strategy for us to be trying to work with partners to actually build in, if we know someone's going to be building some kind of project, to build in, the block of 5, 5 rooms with some, common service area or things like that, or whether these, I guess I'm trying to get a sense of what the model is for creating these spaces, whether it's best to, whether it's easy to find a commercial building that you can convert, or whether it's, better to purpose build these, whether it's okay if you are purpose building them to kind of mix it with some other, some other capital construction project that's already happening, like, for example, like the La Pine Community Health Clinic, their new, their expansion, or, whether it might have made sense to, as we were thinking about our North County, our North County campus, whether it might have made sense to try to build something like, build some treatment beds in a block into a project like that, or whether it's better to put them, have it be separate from, other kinds of county functions.
Well,
Sorry, that was a lot of questions.
that was a lot. Let me say this. As you've heard Colleen Thomas and other individuals who talk about unhoused individuals, many of whom, not all, but many of whom struggle with serious and persistent mental illness and chemical dependency, you sort of need the whole array. And for this particular population, for our SBMI individuals served in these residential treatment settings, we also need a continuum. So having these projects consider the housing projects that are being planned all over the county, and there are numerous, having them consider that they are going to need to build in mental health supports is one critical piece. And we've seen some real progress on that front. We've seen all of you really aware that when you're talking about serving an unhoused population, you need to be prepared to wrap some supports around individuals, including maybe some on-site or some in-reach behavioral health care. So that's sort of step one. Step one is, yes, absolutely. Let's make sure that when we're standing up a shelter or supported housing, we're thinking about the fact that many of these people will have mental health needs, and we're planning for that with FTE or with dollars for accessing resources. Or with design. How are we designing this space to be trauma informed, to have private rooms where people can drop in and provide services, et cetera? And I know that planning is going on. Second, it isn't always the best idea to co-locate housing with outpatient services for lots of reasons, partly because housing is so costly, and often the people who are going to access outpatient services may not be comfortable accessing a space where housing is also provided on site. However, we are looking currently at several projects, and that's what I was going to talk with you about in this slide. We have 2 pots of money that are coming to counties that create opportunities to stand up some treatment beds. One is the appropriation of the legislature in February that identified about $100 million specifically for community mental health programs to use for one-time projects to address this critical need for treatment beds. We know the amount that we're receiving. It's $3.9 million. We're in the process of planning for the expenditure, and we're basing that planning on the planning grant findings that came out late last year. We already have partners at the table who would be able to provide services, and we have a possible building site that I won't talk about in a public meeting until they've sorted through the negotiation, but there is a very good possible building site that would have adjacency to mental health services and be in the northern part of the county. There is also just released the Friday that I left for vacation, so I think May 6th, there was the release of the Oregon Health Authority's call for proposals for 2 different possibilities. One was supported housing and the other was residential treatment, secure residential treatment. I know that we will be collaborating with our regional CMHP partners, Pacific Source, and a provider on an application to potentially stand up another 16-bed secure residential treatment facility, which is one of the acute and critical needs that was identified by the planning grants. And then we are also looking at whether or not some of those dollars can be carved out and set aside to address youth needs. Currently, that planning is still in process and under discussion. So I think we're very clear on the need for an additional 16-bed SRTF. What we're going to be able to stand up and offer with respect to children and youth, we're still discussing. But as you know, there is a dearth of beds available for children with acute psychiatric disorders who need inpatient residential in our part of the state. Most kids have to go over the mountain to a more urban or metropolitan area to get those kinds of services. And currently, our hospital is really interested in seeing if we can come up with a small offering for children who are spending a lot of time being boarded in the ED with acute psychiatric presentations because there's no treatment bed for them. So I said a lot. I want to pause here because there may be lots of questions about this part of the discussion.
One other question I have is where does Cleveland Commons fit into this? My impression is that a significant component of the people who are who live at Cleveland Commons are going to be people with chronic mental health challenges. But are those people who are less acute than the folks we're talking about who might go into one of these four categories of treatment facilities?
I have just a couple clarifying. I think Cleveland Commons is geared towards houseless people with acute physical health issues, and they might have a co-occurring behavioral health issue, but that was the slice of the pie that they were going to address, is people with chronic and acute health issues, but not necessarily behavioral health. We are going to be partnering with them doing InReach. Certainly we're going to serve any client we have there in all the ways we always serve our clients, but we'll also be doing InReach to the larger milieu there.
Okay, thank you.
Yeah. And we actually have an MOU in process with Cleveland Commons now to reflect the arrangement that Kara is describing. One of the positive aspects of the Commons is that because it's a partnership with Mosaic as well, we're hoping that some of their behavioral health consultants and psychiatric capacity might be available to those individuals with chronic health conditions and mental health conditions. But we know that we think that a large number of individuals served at Cleveland Commons and housed there will have mental health conditions. So I'm sure we'll be involved with our clients there.
Right, but it's not being set up to serve people with acute chronic behavioral health issues.
It's being set up to serve individuals who are not housed and have chronic health conditions. And I'm here to tell you, knowing that population, there's going to be a number of them that also have acute mental health conditions that will require support.
Got it. Okay, thank you. And my other question was, so you identified four types of residential treatment facilities, and I was wondering, I know that a focus for pursuing grant fundings is going to be the secure residential treatment facility, but do we have substantial need in the other three categories as well, or is that need just kind of head and shoulders above the others in terms of being the strategic kind of place for us to focus right now?
Yes.
Yeah, any capacity helps, right? Like, because we're in gridlock right now. So any additional capacity helps with the amount of funds we're going to get. We thought the use for a secure facility was the most bang for our buck, and we really need to be moving people out of the state hospital on aid and assist, and they can't often go to lower levels of care. And we have a large civil commitment population that is not in adequate treatment. Because the state hospital closure to them. So it would really help those clients quite a lot.
I realize.
Just to be clear, because we throw these terms around a lot. When we talk about aid and assist, we're talking about people that are committed while we're making efforts to restore them to capacity to stand trial. And because of some of the lawsuits and findings and statutes, we really have to prioritize that population. They cannot be sitting in a jail cell with an acute psychotic disorder, not able to access treatment. So we have to prioritize that population. The civil commitment population is a group of people who can be very, very ill and really struggling with symptoms. They've been civilly committed because they're struggling enough that they're considered potentially at risk to themselves or sometimes others. They need acute care, but they are one step down in the priority list just because of the bottleneck created by the aid and assist population. So those are the two populations that really intersect around the availability of this housing and access to this housing. And Commissioner Chang, in order to, it probably costs somewhere between $12 and $15 million is what I'm told to stand up an SRTF, a 16-bed secure residential treatment facility. So what we can offer is simply match funds to an application that either the provider or another county will submit, hopefully to pull the entirety of the resource together through the various sources of funding. So we just had to prioritize. 3.9 million sounds like a lot, but when you're talking about facilities that are secure places to treat folks with mental health conditions and have to meet all the requirements of those facilities to be certified or to be licensed, it's a costly endeavor. So yes, ultimately, we'd love to have more step-down opportunities in the community, like residential treatment homes, foster homes, et cetera, but we can't do it all with the resources available.
We can't do it all. I realize we're at the bottom. We're number 50 in the nation for residential treatment beds, and that's not your fault, Janice. That's not Kara's fault. But truly, that's where our state has at this moment in time. And when you look at the fact that the state hospital in Pendleton closed in 2014, and we recognize, per Dr. Berry, that at one point in time, Oregon had 5,500 people in mental health and psychiatric hospitals. Probably, undoubtedly, that was way too many, but today, we're at the bottom end, and, 3.9 million, it's really extremely poor funding. If you look at how much is on this side of the mountain, the fact that the psychiatric hospital in Hermiston was briefly open for six months, and the state of Oregon did not license that facility, even though it was licensed by the state of Washington. It's a brand-new facility. The 16-bed, I believe that comes from the federal government, and truly, I think we need to all let our federal government know that 16 beds is really a cap that needs to be double, tripled, whatever, so that it can be more cost-effective. If you're telling me we only can have 5 beds at one of these, the residential treatment homes, that seems, and we lost one of those 2018. Truly, they need to be looking at their numbers in order to get out of 50th. We really, civil commitments, they're not being helped. Aid and assist is a nightmare. The state hospital, the 60 beds at Wilsonville, they aren't going to be added to the program. They changed their mind. I'm not blaming you guys. I'm just saying the problem is so huge. We really need to do something here, and that's why I kept talking about Deer Ridge, because it's not in Deschutes County. It's in Jefferson County, but it's a facility that surely could help some of those people. When I was reading an article from Portland saying that I believe it was like 70% of the people were, substance use disorder and mental illness together. Truly, they need help, and 4 days of help isn't enough. And then the people, when you look at the people, the minimum security prison at Deer Ridge, at the other side of the campus, 60-70% of them are mentally ill. So I don't know why we can't get our state to actually go in there and actually do something. The facility has never been used, the half that I toured. It's quite lovely. It's got a lot of space around it to walk, and, actually, I was shocked how nice it was. So I really feel like, there is no place to go but up, and truly, we need to go up faster than, in 6 years or something, whatever we're thinking about. I see that we've got to spend this money by June 30th of next year. Okay, that's like, what is it, 13 months away? Or we have to have it planned or committed. But truly, we need those beds like yesterday, not in 2 years. So whatever we're thinking about doing, there's a lot of things we need to do. And I honestly think our federal government needs to change that 16-bed limit. That is to, for funding. When I was talking to Senator Lieber about this, she's saying, well, everything needs to be in 16-bed increments, and truly that is really too small to, I think, handle what we are dealing with at this moment in time. Oregon has truly not addressed the issue for, quite a while. Pendleton's been closed since 7 years now. And, we have Junction City, we don't have Wilsonville, and for some reason Hermiston wasn't licensed. So I so appreciate your efforts and what we can do. And, when we have people that are naked in downtown Bend that can't get help, we've got to quit putting Band-Aids on people and truly get them help, because what is it, Janice, as you say, the longer you deal with mental illness without getting help, it only gets worse. And we have people in our community that need help, and they needed it yesterday.
Yeah.
The 16-bed federal cap, I definitely think is something worth talking with our federal legislators about, our congressional delegation about, and I think that points to, when we're looking at our lobbying contract, there are probably a handful of things like this that are so relevant to county operations and county responsibilities and goals, that some very targeted federal advocacy might be able to make a difference on that. I definitely would just like to flag that as something that we need to be thinking about beyond our state legislative advocacy.
Thank you. I truly think it needs to be upgraded. It's 16. I don't know where they got that number, but truly, from what I've seen, it's minimal. And why would you build something for 16 when really we need 32, 104, whatever works. I just think of the lovely new memory care facility that just opened up down on Burgess Road, and they're hoping to license it for more than, I think they're licensed currently for 30, but they have wings, and it's so nice, and it's, you can arrange things so that people are treated respectfully, but they're actually helped. And truly, we haven't been helping a lot of our population. And it's not your fault. I get it. I'm not casting blame. I'm just saying we need to get to the federal government and, make a difference on that 16-bed cap so that more people recognize it's not working. Truly, where are the last 50 people that were kicked out of Pendleton? If we trace them down today, where would we find them if they're still alive? So it's not been good.
Well, I definitely appreciate, it's very clear to me that our county commissioners care about this service population, and that means a lot to us. So we appreciate the opportunity to talk about these folks and talk about what they struggle with and how we try to support them. And I appreciate that very much. And I do think there's some hope on the horizon. I think these dollars were a real investment on the part of the legislature. I think that the efforts that you all have supported around the various projects to end homelessness or address homelessness will make a difference for our service population, because there's some intersection there and there's some overlap there. I think the investments in behavioral health in general and crisis services and CCBHCs, all of these things do make a difference. And while we're struggling in our community, we are doing better than other counties. And it is in part because of CCBHC, because of county support for our services, because of a strong relationship with our hospital and our CCO, with our courts. So there are things we can do as we navigate really tough times for people with mental illness, and we're doing those things. And a lot of it we've done with your support and with your oversight. So we are glad that you care enough to invite us to come talk about this.
And we can work on, we can advocate for the state to explore Deer Ridge as, a second state hospital at the same time that we're trying to set up another secure residential treatment facility here in our community, so that when people get out of the state hospital, they have someplace to step down to. Because that need will still be there whether we can increase the state hospital capacity or not.
Yeah, if that's an avenue that you are seriously considering pursuing, I think the original reluctance to look at Deer Ridge had to do with its physical location and the difficulty staffing these facilities. So there may be some solutions to that. There may be solutions like housing for employees, or enhanced wages, or other efforts that I think the legislature has been interested in terms of the behavioral health workforce. Rates of reimbursement for these kinds of facilities have really been problematic and have helped to shrink the field of options. So certainly opportunities for advocacy.
When I had my tour.
And I'm always,
Oh, Janice, I was just going to say, when I had my tour that morning, I think I actually talked to about 5 people that worked, certified mental health professionals that worked in the prison, and most of them lived in Redmond. It's only like a 20-plus mile drive from Redmond to Madras, and housing is, I think it is a bit cheaper in Madras. So I know they have their issues too.
Madras.
But
Yeah, it's hard to attract psychiatric staff, psychiatric nurses, master's level clinicians to live and work in some of our smaller communities. It's just really a challenge. So it's not insurmountable, but it has been a challenge. And if they pay better than we do, then we're fighting them for staff. So it's just, it's a limited resource. We need to grow the profession. And that's probably a long-term goal, but we definitely need to keep thinking about talking to young people about why this is cool work and great work, and all the opportunities to do the work in the community.
Oh, I just met the most amazing young man who's graduating from Lapine High School, who's going to Johns Hopkins, and he's majoring in public health. So I was like,
Great.
yes, the teacher in charge of the Honor Society or whatever from Lapine, I also met her, but it was amazing to meet someone who was so, he was on a path, public health, and I thought that was wonderful and outstanding for that program to be so proud of themselves.
Yeah.
But remember, Redmond's houses are about $200,000 less than Bend, and Redmond is now over 30,000 in a population. So Redmond's definitely booming. And, it's worth a gamble. We truly need to do something. I want to get out of 50th, Janice. I want to move up to at least 40th, right? We can do this. It's like, it's all up. It's all get better. Did you guys want to go over that last page?
I really covered it verbally.
Okay,
And
I know you did.
I'm conscious of time. We're way
Okay.
over, and I'm actually
Yes.
next.
Okay.
Next on your list, so I don't get to go.
Okay, do you want to skip
Dennis,
ahead?
you'll keep us posted on that funding application, though.
We will absolutely keep you posted on the funding application. So I will have to submit something in the next couple months, probably sooner than later. They gave us a 3-page application. It's pretty straightforward. I'm working with county legal on a couple of questions around Are we able to pass money through? If we do an RFP, what does that look like? All of that, of course, would be coming before you at the point of application. So you will be kept up to date on this project.
Thank you.
And there is,
Yeah.
I mean, so there's funding, there's a building, but I mean, do you already have an organization in mind that would operate this? Is that like someone who's partnering or, actively interested and engaged in the planning for this new facility?
Yes.
Great, thank you.
Yes. Yeah.
Right.
Okay. Should we go to item number 3, please? Janice, that's you.
That is me, and I would love to let Kira go. Kira, thank you so much.
Thank you. Thank you, Commissioners.
Thank you, Kara.
Okay, shifting gears. I am here to request board's consideration and signature on document number 2022-405, OHA agreement number 173133-4. And basically, and I think Cheryl Smallman may also be in attendance, so if you have specific fiscal questions, she might be available to respond. The
Yes.
Oregon Health Authority, yes, ma'am.
No, she is in the back of the room, so she's here too.
Oh, she's here physically. That's right. She told me she would be there in person.
She brought the twins. Not?
No.
When is she going to bring those twins in? We want to hear them.
Yeah, so this particular amendment really reflects a cost of living increase that occurred, I believe, in July of 2021. And it took a while to sort of make its way through the contracting process and be reflected in contract amendments in specific service element areas where county general fund is, or state general fund is represented. So you'll see the specific amounts under certain service elements there, but the rough total, or not the rough total, the exact total of the revenue increase is $367,429 in revenue for the, oh gosh, Cheryl will have to help me. I believe this is for the rest of the biennium. There she is.
Yes, thank you, Cheryl.
Cheryl Smallman, Business Officer for Health Services. It is for the calendar year. The Behavioral Health IGA Intergovernmental Agreement works from January 1 to December 31st. There's one service element, I believe it's service element 20, that's retroactive to July 1, but the others represent 6 months in fiscal year 22 and 6 months in 23.
Are there any questions?
I'll move approval of chair signature of document number 2022-405, the OHA agreement for administrative adjustments and inflation.
Second.
Any further discussion? Commissioner DeBonne?
Yes.
Commissioner Chang?
Yes.
And the chair votes yes. So thank you, Janice. Hope you feel better
Thank
tomorrow.
you, Commissioners. Yeah, thank you. Have a good rest of your day.
Yes, thank you, thank you. Okay, item number 4. It looks like we have a whole group. Betsy, welcome.
I'm Betsy Tucker, Senior Budget Analyst, and this afternoon I'm here to review the proposed fee schedule with you. And this is an annual process that the departments do, and we do this before we adopt next year's budget. The information that you have in front of you, those proposed fee changes are reflected in the proposed budget, and you'll get a copy of that on Wednesday. I put a packet together for you, and what it shows you are just the fees that are changing, and those are organized by department. On the spreadsheet, you'll see on the far right column that I've included a summary explanation for why the fees are changing. And then towards the back of the packet, I have included a handful of memos from the departments that explain in a little more detail what the changes are. And I also have a handful of folks in the wings, should you have any specific questions or want to have any conversation around these changes.
So one of the items you just clarified is this is all items that have changes, up or down.
Correct. So what you'll see are, there are a handful of fees that have been added. There are a few fees that have been removed, and then the rest are either increasing or decreasing.
And this isn't the complete fee schedule.
It's not the complete fee schedule. I do have that handy if you want to look at every line, but I thought I would just give you a summary today to make it a little easier to go through.
It's just good to put it in perspective, though, because I reviewed this, and then when you said, oh, yeah, these are just the ones that change, it's like, oh, yeah, that's true. There's there's more line items for these.
There are more, and if you want one, I have
No, I
one
don't
right
need
here for you.
And a lot of the increases look like they're basically just CPI.
Yep. Yep, most of them are. There are a handful that are sort of a right sizing. Maybe we haven't increased the fee in a couple years, and somebody noticed that this time around and wanted to change that. Let's see. So I don't know, we can look at them one by one, or if there are any that stand out to you, I'd be happy to take those questions.
Well, I had a question, because we're always talking about affordable housing here, and they're picking up a number from Seattle area, an increase of 6.8% for the, what is it, SDC inflation adjustment?
For transportation?
Yes. And I'm just like, okay, that's, it's only $323, but that means that that project you're doing is going to cost more money. And right now, everything is costing more money. And when was the last time is that fee adjusted every year? It is, isn't it?
Yes.
And do we have to adjust it by that much?
Chris Doty's online, our road
I
department.
know, I'm sure he loves oh, there you are, Chris. You're behind me, too. I know, I'm just like, my God, Chris, everything is going up, and I just feel like, oh, Lord, we're trying to always talk about how we can help make things affordable, and so here's another $323 we're talking about collecting.
Yeah. So just by way of history, that fee increase, or the SCC is adjusted annually based on the Engineering News Record Construction Cost Index. It's a way to adjust for it specific to construction inflation. And so that is prescribed within the SDC resolution that the board passed. The fact that we're making this a part of the fee schedule coming forward is certainly presents it as an item that the board has discretion on increasing or what have you. However, it is prescribed within a resolution that the board has already has in place. And it is, it's just capturing, to make sure that as construction projects happen, that our funding source maintains its integrity in relation to inflation, so that we're not overcharging or undercharging as it relates to gross proportional share of the capital projects. I will add, Commissioner, that we just have the transportation SDC at the county of $4,000 to $5,000 per trip. We do not have wastewater. We do not have water, parks, other SDCs that can push that system development charge amount upwards of $20,000 to $30,000 that the municipalities have. So it's a slight, it's there to fund, help fund growth share of our capital project list. But if you're building in the county, you're not contributing to other forms of infrastructure system development charges.
I just remember hearing from someone who just finished her house, and she was so upset because I think she had waited to pay this. And, and when you're done building your house, you've probably already spent a lot of money. And anyway, I just thought I would ask.
Yeah, thank you.
We have seen in some of the recent contract approvals that have come from roads recently how our costs are escalating, and like chip seal project going up, this or that other project. I mean, the cost of providing adequate roads to new homes out in the county is we have to capture that.
So page 65, Fair and Expo, it says Haystack and items number 15 and 16. Are these duplicate or so?
Good catch. I think the description may need to be updated. I can work with Jeff on that. And he may be
I saw him on there too. So it's just, yeah, I saw that it was kind of the same description, different fees, different amounts.
I'd have to get back to you on that one.
And then, yeah, just acknowledging separating out a 30 amp and a 50 amp opportunity when you're camping. So one of the funny bumper stickers on the big RV is 30 amps is roughing it. So that's for the big rigs, when they're driving down the road looking for the double air conditioner or whatever it is. But so there's truly some legislative or Oregon Health Plan numbers that went down here. I started looking down through the list, and all of a sudden there's some of them being lowered. But thank you for the notes in there, kind of mapping back to how that can be. And then the rest is truly just kind of cost of living percentage updates on a lot of different items.
Yep.
This is where inflation gets calculated locally. I mean, this is it. Little bit of cost of doing business everywhere. But I don't have any other questions. I don't know if
When we had our pre-meeting with Health Services a couple weeks ago, I had asked. I'm glad to see Eric Moniz on here. I had asked about our staffing ratios for the number of inspections that people are that staff people are having to do, and tried to just connect that with the fee structure, because I do believe that maybe before COVID, we were looking at fee increases to try to generate enough revenue to have more sustainable staffing levels, so that we're not burning people out. And I was just curious about the status of that kind of long-term plan to work with the fee schedule, boost the environmental health staffing so that it all works smoothly.
Hello, Commissioner Chang. This is Tom Kuhn from Deschutes County Health Services, and I am joined by, go ahead, Eric.
Eric Money here, Deschutes County Environmental Health Supervisor.
And we're prepared to give a brief update in response to your question during the budget hearing. And if I'd be able to share my screen, we'll just run through just a couple slides that we put together for you all.
There we go.
So you anticipate.
So anyways, the question was, what would it take FTE-wise for us to reach the FDA standard, which is 280 to 320 food service inspections per 1.0 FTE. So just going to run through a couple slides, give a little context. Okay. You saw this slide during the budget presentation. It's just something to remind us all that before the pandemic, restaurants and so forth, other licensed facilities were really starting to move up, and we had a little bit of a lull during the pandemic, and now that what we're considering post-pandemic, we're showing that our numbers are even higher than it was pre-pandemic. And so this is a really good sign that these businesses are rebounding and showing that there will be more and more need for inspections and the services we provide in environmental health. All right.
Okay, there it is. Next slide, this just shows where the majority of our revenues come from. Restaurant fees, 61.5%. Pool and spa fees are right up there as well, but then mobile food units are nearly 10%. So we're looking at 70% of our fee income coming from restaurants and mobile units alone. And that doesn't also include some other food service related fees that we do charge, such as plan reviews and so forth. So I just wanted to show that food service is a huge part of our revenue. So Eric, if you want to go from here.
Thanks, Tom, and thanks, Commissioner Chang, for that question that you'd asked about inspection ratios. I do have good news related to our inspections, and we're about to go live with our inspections website, which has been a little glitchy. We're using the Oregon Health Authority's database and platform for those inspections, but we're going to go live with it. Still got few little issues, but we've done over 300 inspections in the field in calendar year 22. So we're getting back out there and doing the work that we're supposed to be doing as far as foodborne illness and waterborne illness prevention and the education that we try to provide. For this calendar year, we have issued licenses for 737 restaurants, and that also counts the commissaries and food warehouses that we inspect. And then 240 mobile units, and both the restaurants and that mobile units could be food trucks or food carts, and those are inspected twice a year. I like to say that it took us 30 years to get to 100 mobile food units, and then it's taken us 5 years to get up to 240 mobile food units. So those are really exponentially expanding. We also had the food cart lots, if you've seen those, we call them pods. We had six or 7 years ago, we had 0, and now we've got almost 20 in the county with the tap room and the food trucks. And then 270 pools and spas, and those are inspected twice a year. Only once if it's an outdoor pool that's only open 4 months a year or so. And those are at anything from apartment complexes to Black Butte Ranch and Sun River and all the motels and hotels. The spa term is interchangeably used also as hot tubs. So that's the nomenclature there. And then 135 hotels, motels, recreation parks, and campgrounds. We inspect those once a year. 159, we're projecting about 159 temporary restaurants, say at Brewfest or Pole Pedal Paddle. We were out there inspecting Friday night and Saturday at those events. So the good news is the events are coming back. I think there's over 100 concerts that are going to have a lot of food service at the Hayden Homes Amphitheater. So we're excited to get out there and try to educate and prevent illness as we can. And then 185 regulated public water systems. So if there's over 3 connections or up to 3,500 connections, we inspect those public water systems. Anything over that goes to the state. So City of Bend, City of Redmond are regulated. Those water systems are regulated by the state. And then 95 child care facilities that we inspect once a year. And more population means more schools. And so we're up to 61 school lunch programs, and we inspect those twice a year through a contract with the Department of Education.
And Eric, did I see a note on one of your earlier slides that these last 3 categories, we don't issue them a license, so we're not charging them a fee?
Well, we actually do charge them a fee. I think the slide said we don't license them, but we collect a fee.
Okay.
So yeah, they are licensed. It just the child cares are licensed by the Oregon Child Care Division. And then the schools are, I don't know if they're licensed, but they're operated by the Department of Education. And as a requirement of that, there is a contract with us, any local health department that has to inspect the school lunch programs twice a year.
Okay, thank you. Yeah, I was just concerned if they're not licensed, then how do we pay for the inspections? But they do pay a fee. That's good to know.
Yeah.
Eric, in your vast knowledge, is there any way you can tell me how many restaurants and mobile food trucks we had in, let's say, 2019 before COVID hit in 2020? I'm just wondering, we're like right under 1,000 now, and I've just, like 2 weeks ago, I had 2 restaurants, and one is no longer going to be open on Sundays because they no longer have enough help. They've got to cut back for their help, sanity, and then the other one, they're not going to be open now until after 2 every day. Eliminating their big lunch service. So I was just wondering, do we have a number from 19?
Well, we're up over 5% on food trucks and licenses issued for restaurants and food trucks.
That's what I was thinking.
Yeah, so I think without the pandemic, we would be more than that. But I mean, the good news on the one hand is that we have not suffered in the amount of licenses issued. There are these challenges, obviously, Commissioner Adair, with staffing.
Right.
And the hours are being impacted. I hope that gets better as COVID wanes. We don't really know exactly, but from day to day, it seems like restaurants are having to sometimes change their hours and days of operation.
Definitely, yes, they're not open on Wednesdays, they're not open on Sunday and Mondays. Yeah, I know everyone is trying to be as flexible as they can and be as concerned with their staff. So, you just can't burn out your staff. So, have we had any problems with horrible outbreaks in Deschutes County in the last, 3 years? What is it, E. coli or something, salmonella? Have we had anything like that we should be concerned with?
Well, it's hard to say. I mean, foodborne illness by nature is probably the most underreported illness on the planet. And so when people have gastrointestinal symptoms, they really aren't. We do get reports and complaints. But it's very underreported, and so when we do get the complaints, we follow up on them with the facility and see if they've gotten other complaints and try to triangulate. If we get more than one complaint, what's the common denominator? Was it really from this place that they said it was from? And do an investigation that way. We have been a little bit derailed by our COVID response. And we're coming out of that, but for a couple of years since March of 2020, we were really all in and focused on trying to prevent the spread of COVID in our local businesses. So we didn't have any outbreaks that we know of that were explosive and made the newspapers, and there was 80 people that got sick from this one place, this one restaurant. But that's not to say that it wasn't happening. And our surveillance just wasn't as on point with food service as it could have been, in large part because of our redirection there.
Okay, so you said no explosive outbreaks then, so that's good news.
Not that we know of.
Okay, well, I'm sure someone would have heard of it.
Well, the one slide that's up there now, Commissioner, is that the federal government has the Food and Drug Administration, and they have years ago come up with 9 program standards that if you meet those standards, it essentially shows that you've got an exemplary food service program and that you're meeting this level of excellence. And so years ago, I said, let's try to tackle these standards and look them over and work with the local regional FDA rep to figure out how can we work on meeting these? Do we have the capacity and kind of see where our gaps are? And so one part of one of the standards does have the 280 to 320 inspections per year per one FTE. And so currently we have 5.05 FTE food service inspectors. And given the volume of inspections that are required each year in food service operations, that projects to 462 annual inspections. So I think that commissioners, you've been made aware of this, and then Tom can kind of highlight what it would take to get down to roughly 300 food inspections per year.
So we need to add 3 more, right, Tom?
Yeah, pretty much. So we crunched the numbers, did the math, and it would take approximately 2.75 FTE food service inspectors. And, you know, when we give this FTE for food service inspectors, just to keep in mind that some staff are 1.0 fully dedicated food service, and then some are maybe like 0.75 or a different combination. So that's how we add up our total FTE. But the cost of 2.75 FTE would cost $314,000 total, fully costed out, all expenses. And to cover this, we need to raise our food service fees because, you know, this is applicable to food service only. You know, this does not apply to, say, pool and spa. So if we'd have to raise those fees by 37% or identify another funding source to meet the FDA standard. So this is kind of the bottom line for the question that Commissioner Chang had. So yeah, it was very interesting to see what that would take. Honestly, we never bothered ever to calculate that amount. And so this was kind of a nice opportunity to do so.
It's a pretty big number.
Yes.
Yeah, but I mean, in terms of identifying another funding source, we we have discussed before, or I had proposed before. We think about transient room tax as a source for this. I definitely think you could say that the number of excellent restaurants that we have in Bend is part of, and in Deschutes County is part of what brings people here, brings tourists here. So there is in my mind, a nice tight link between having tourists come here and spend money on lodging and maintaining an adequate service to have an excellent food scene. And 300, what was it?
314,000.
314,000. It's, maybe we have a little fee increase, put in a little bit of transient room tax revenue, and we can close the gap a little bit more. I guess the one other thing I would ask about this is, are we, within environmental health, are we having the kind of recruitment and retention challenges that we are in some of the other branches of health services?
Yes, very much so. It's taken us, for example, one of our recently filled position who is doing food service 1.0 started 2 weeks ago, and this was a position we started recruiting for July 1st. So just an example of, it's taken a long time. We're getting people trickling in, but it's not at all like it used to be.
Right. Yeah, competitive salary and benefits is a good thing, but not signing people up to really what apparently the FDA thinks would be an unsustainable workload. That's another thing.
Yeah, the people that have applied have, there have been people who were qualified applicants, and we had conversations back and forth about, can I come in at the step 7 salary range so that I can afford to live there? And so anyway, without getting into the gory details, there have been some people who were qualified from that lived in other states that wanted to move to Central Oregon, but they were saying that they needed more to live here, and our hands are tied in some respects there. But we have, like Tom said, we got a really good inspector that came on board a couple weeks ago, so we're excited for that. And the inspection volume for each inspector has gone down thanks to that hire. So I just appreciate all the support commissioners have given us over the years in that regard.
So that number isn't into the 5.05 then? Or it isn't?
It is.
It is into it, even though he's only been here for 2 weeks?
Correct. We wanted to get that, we wanted to make that number accurate as to date.
Yeah, we just, once she started, then as we were working on this, then we're like, oh, we need to increase it. So.
Well, I'm glad
And it's
that we're
still at
successful.
And it's still at 462.
Right.
Correct.
Okay. So that means that it was really at 545 or something before.
Yes, it was,
You guys, you should have left that person out if you, if they were really working that, almost double what the FDA was recommending.
We have a lot of
I think you were
professional,
trying to, oh, sorry, Commissioner.
just acknowledging a lot of professional people in the industry, restaurant owners, people that are experienced, that have been inspected before. So, I mean, I think there's a good culture of Deschutes County Food Service people even. So yes, that's a goal, but just concluding, we don't have outbreaks, we don't have, big issues. So, and that's the goal, right? The big picture is to make sure there's safe food and safe environments for prepping and eating food.
Yes, don't use the same plastic cutting board when you're doing different things. Yes, we know all those rules, don't we? Okay. Yes, don't come to my house because I follow all those important rules. No, I do. I try to anyway. So, well, interesting. Okay, this is something we can think about then? Okay, good. Is, any other questions for Betsy? Is there anyone else that needs
Thank you very much for
to?
having us on.
Thank you.
Thanks to everybody for being
Oh,
available.
I do see Pamela's on. Pamela, I have a question for you. Or maybe, yes.
Yep.
Pam, is it really true that there isn't a baby formula that people can use? I mean, it's in today's world where we're saying, isn't that one of your expertise? I'm hearing the state person said today that, no, don't make your own formula up. And I'm going, well, what did people do in the 1930s or the 1940s when they were working, when moms went to work and they needed to be able to feed their babies?
Commissioner Adair, Pamela Ferguson, one of the public health program managers, and WIC is one of my programs. And
Yes, that's what I heard.
we are required to follow state guidelines and federal guidelines. So yes, the recommendation is that you don't try to make your own, perhaps with milk and sugar, and it's really the right thing to do is to buy something that is approved by the FDA. And it sounds like there's Abbott is coming forward with more formula very soon. So our teams are working hard to help families find formula as well.
Well, one of my friends just had a baby 2 months ago and, had bought some product in California, got home and couldn't find it here, called her family in California, and it's not on their shelves now either. So, if you're in the middle, it's pretty, can be overwhelming.
Yeah, it's been a big problem, but it sounds like communities are helping each other. And again, we should have more formula coming out on the shelves very soon.
Like when you say very soon, do you mean like in 2 weeks? Or what is very soon?
What I heard was in the next couple of weeks, they will be producing more and distributing more.
Okay, sorry to put you on the spot for this. I just think it's a really important dynamic issue in today's world that since I had someone personally involved with it and couldn't find it, it's a bit overwhelming. So thank you.
It is, yeah.
Okay, so.
Thank you for the question.
I know, I saw the recipe from like the Dark Ages, and I think it said it had honey in it or something, and canned milk. Isn't that what they say? Anyway, I was like going, well, it sounded enticing, not. Yes, Betsy, do you have any more?
I don't have anything else. I believe we will be back before July 1st to formally adopt the fee schedule. So, thank you very much.
Thank you.
Thanks, everybody.
Okay, so I believe now we have Peter and Sherry, item number 5.
Good afternoon, Commissioner. Sherry Pinner with Community Development. I'm an analyst for the department.
Sorry. Hi, Madam Chair, members of the commission. Peter Gutowski, Community Development Director.
Welcome this afternoon.
So thank you for allowing us to join you to have a brief discussion about a reserve policy that CDD prepared in 2017, discussed with the board at that time, and we just wanted to bring it back for a further discussion. A little bit of history. So there was an internal audit, audit number 15/16 number 1, which recommended community development create a reserve policy. As I stated, we prepared that policy back in 2017 with the involvement of the county internal auditor, the county finance director at the time. We also had an outside an accounting partners contract with a staff member named Dan Eds, who had recently performed a kind of a cost study for community development. He also gave some feedback on the policy. A little bit of history on community development's use of reserve funds in the past, and this was during the Great Recession. So from the time period 2008 through 2013, community development experienced a decrease in permitting volumes. Therefore, they had to dip into their reserves, and then shortly thereafter, when those were expended, general fund stepped in to help support the department. And what that looked like is over that time period was about $10.3 million. About half of that came from community development's reserve funds, and about $5.3 million came from general fund. As I mentioned, we had this discussion in 2017, and at the time, the current board really supported having a policy, but it was really left to be sort of an internal guideline. And with the budget presentations and the budget cycle coming up next week, we thought that this was a really great time to just revisit this policy. One, make sure that you are aware of it, and of course, like I said, it's really an informal internal guideline. And then to see if you had any questions or guidance for us to make any revisions or have some considerations.
So one of the points is that in that 2009, 10, 11 timeframe, the department shrunk by like 75% too, right? I mean, it really, yeah, that way everything just stopped dead in its tracks and went through the reserves, and it was backfilled by the general fund. So just, acknowledging that, those are very challenging times for everybody that was there. And we've been on a kind of a slow ride out of that for about 10 years, and construction and development pressure looks like it's still here. We'll see if there's another cycle that stops that, but it sure hasn't slowed down yet.
Yeah, and if I may, as noted in the memo, our internal guidelines that we're wanting to be completely transparent is having a lower limit at the 8-month level. Again, it's going to ebb and flow depending on operational expenditures, and then that upper limit, taking us to, up to 18 months. Sherry, as the management analyst, monitors our intake, our expenditures, and revenue every month. And so if we ever fell below that 8-month threshold, we would, of course, let admin and the board know. And similarly, as if we find that our various reserve funds are starting to get to that upper limit, well, it'd be time to come back to the board and, have we reached our, a healthy capacity for reserves, because there certainly is an upper limit there. But that was our internal framework that we wanted to underscore. And again, we're, as much as any other department, we track our intake, I dare say weekly, and then of course monthly with the various reports that Sherry generates. So we're very sensitive to it. As Commissioner DeBone noted, we're several of us were here during that time, and we want to just be mindful of the department's resources and certainly the funds that our customers are paying to make sure that we're operational, can provide the services that they expect.
So we're not at the target reserve balance of 12 months. I'm just curious if there's you could track over time for me, kind of, have we been slowly approaching that? Did we, are we topped out at 10 months and we're never going to get to 12 months, or kind of like what is the trend
It has increased each year since about 2015, the reserve fund balances, and we are currently at about 10 and a half months operating expenditures based on our fiscal year 23 budget.
And Sherry, certainly for the budget's consideration, there's the CPI, the COLA that's being contemplated. That certainly was applied to our department to the extent that that's supported by the budget committee and the board ultimately for next fiscal year. So that is that's budgeted into that.
I think that's all kind of stabilized for what's going to happen on July 1st. I don't think there's any other budget decisions there, is there? Because it's the represented contract plus 2%, which is already committed to. So yeah, I think we're pretty stable on the.
Yeah, I just want to acknowledge that
Yeah.
we paid
It's in
for
there.
that out of our fund.
Got it. Got it.
And you're still at 10 and a half months. Okay.
Correct. Yeah. And I think it's worth just pointing out, we have 4 reserve funds. 2 are required by OARs, so the Building Safety and Electrical Reserve, or I'm sorry, by ORSs. And then there's a 3rd fund, which would then fund all the code compliance, advanced planning, current planning, administrative staff. And then we have a 4th fund that will be opening this budget cycle as a CDD improvement fund. And that one is one that was used in the past, but we're reopening it in the event that we need to make improvements to our building, which I believe is somewhere around 2 to 3 decades old. And so we're anticipating some capital improvements related to that.
And do you anticipate that those will be major capital improvements, or, you know? We got a lot of capital projects going on right now.
Yeah, so I think it's really more not something that we're aware of right now. We have some minor repairs that are being made right now, but it really brought to light that there will likely be at some point some capital improvement that would need to occur. And I think best to start funding that now and start thinking about those types of improvements, earmarking those monies to be used for that specific purpose.
Yeah, for those that have been in the department I've been in the department since 2004, you find yourself moving in different corners as sections increase or decrease, or there's synergy in one corner versus another. It's really, I think, to make sure that we're maximizing, cubicles and, just, I think it's part of this budget. We because of the importance of in-person and virtual meetings, we have a conference room that will allow that to happen seamlessly. For example, we meet with COBA and CORE monthly. They're relying on that. Some come in, or some did come in before the pandemic. More are finding that it's really convenient to be virtual, but it's just making sure that we're staying on top of technology and just kind of brick and mortar for our staff to ensure that they have the workstations to, stay productive.
And Commissioners, if I can just offer, one of the reasons I'm so supportive of this, and we closed this 5 years or so ago, and to bring it back is just as we think about CDD operations in other parts of the county. When not long after I became CDD director, almost a decade ago, we co-located in at least a couple of cases with the City of Sisters and the City of La Pine in their city halls. But as those two cities just burst at the seams, they very well may need those spaces back at some point for their own staff and operations. So we may be in a position of thinking, does CDD go back to the South County campus that we have across the street? And so might CDD need some of this money for operations there or someplace else in Sisters? Whatever the case may be, I think it's a really good fund so that we're not in the position of trying to find those funds from the general fund or bonding or something else, to build this reserve slowly as the department is able to meet those future growth needs.
So is the request that we possibly make this more formal policy, or just that the policy's correct and leave it internal?
We wanted to check in with you, knowing again that, in just a week's time, we're going to be in budget conversations and just wanted to be as transparent as possible.
Why
we're
there's
approaching it.
good.
But again, are open to your feedback and input and any, if you find that we should be going a different direction, of course, we are open to that. We just wanted,
we know that the next week your time is precious and there's a lot to discuss. We just wanted to get ahead of any questions or comments you might have about our contingencies and our reserve policy approach.
So just, I want to repeat what I think you've said, Sherry. We do have 10 and a half months. That's the way it looks as of July 1st. And this is a policy that was recommended 5 years ago by the auditor, and truly it makes sense when you look at how much funding we went through in the last recession, and, you know, a lot of financial people say we're going to be going into another one. And when you think that we actually had to let go more people than we had left on staff, we let 46, I think if my math is right, 46 people we lost them. So truly, I think being prepared is a better way to be.
Thank you, Commissioners.
Well, this is the balance between a fee schedule that has increasing line items in it and the goal of having that reserve and the reserve growing and knowing that we're kind of at the minimum of the reserve. So that's the big picture today.
We're half a month over it.
We're not 18 months.
No, which is really too bad when you think, but then again, you think about the raise that.
But that's millions of dollars, isn't it?
Right.
I mean, that's been built up over time. It's pretty exciting.
Yeah. Can I just make sure I'm tracking correctly? So the capital improvement reserve is a separate reserve. So when we say you've got 10 and a half months of operating funding, that's not including the capital reserve amount.
Does not include.
Okay. Yeah. Well, I mean, the one other thing I would say about this is I do, thinking about community development as a primarily fee-funded department, while there are so many things that we call on community development to do that don't generate fees, I still think is not the appropriate, not the appropriate funding structure. So I would, I'm glad that this reserve is building, but I do think that, we should be considering, a component of general fund, a regular kind of dedicated component of general fund going to the community development department, so that conceivably you could even then reduce the fees that you're charging people if we're concerned about the cost of application fees on someone who's trying to build a home, which are desperately needed in the community. Covering some of our non-fee activity with something besides the fees from fee activity, it could help with that. So I'll put that out there for for consideration during the budget hearings next week. But
What is the balance of Fund 303 then, the capital improvement reserve?
We're going to open it with 200,000 this year. We're planning on spending potentially 50 of that. So it could have a balance of about 150,000 at the end of fiscal year 23.
Thank you, Sherry.
You're welcome.
And traditionally, I've seen general fund support for projects and project-by-project efforts. Something named, something with a scope, and then help funded by general fund. So kind of going down the same path. Could look a little different, but there has been support for projects.
The comprehensive plan update is one of those. There's
And long-term planning was
funds and
by line item, long-term planning, during that recessionary period, that was the valuable time to say, let's write a check to long-term planning while the economy is, struggling or stumbling, because that's the time to plan also.
One of the benefits of having the upper limit as well is it's almost like a performance measure where the department can make informed decisions. Either clearly, if all the revenue's coming in, that's a justification for additional staff to meet the additional service needs, or it is a time, and we've talked about it as recently as last year, it is a time to consider lowering fees because the fee collection is exceeding the cost of service over a sustained period of time. Sometimes you can have those bumps and variations, but it can really help just inform decisions as well.
I mean, talking about like code compliance activity, I mean, it seems like a lot of code compliance activity is many years past the time when there was any kind of a active application for, when you've got X landowner who, paid a fee to, paid an application fee a long time ago, and then, put in a septic system, and then you got code compliance 10 or 15 years later. I mean, there is no fee that is supporting that code compliance activity all those years later, except for fees coming in from someone else's house, right?
Yeah, the code compliance fee is calculated off the building valuation of a permit application.
An active permit application. So, I mean, code compliance, I think, is a good example of this, services that CDD provides that maintain quality of life for everybody in the community. So it just seems appropriate to me that we would apply some general fund property tax dollars to that, because we're maintaining quality of life for everybody. But that's we can.
Yeah, and that's a named project and a named amount, so that's a discussion that we could have.
Okay. Do you guys have enough guidance?
We do.
We do.
Okay, great. Thank you. I mean, when you look at it, okay, so 5 years ago, they said get a reserve built, and, okay, you've got the, the lower level, but at least you've got
Thank
that.
you so much.
Yeah, no, thank you for that. I'm sure that was under the wonderful leadership of our new administrator, right?
It's always a team effort.
A team effort, truly a team effort. Okay. Do we have any other items? I know we have an executive.
Just what I might have done in the last few days, or.
No. I did have a conversation with Nick this morning. Apparently, on the east side of our county, 17 residences have been told that part of their land hasn't been surveyed properly. So trying to get to the bottom of that situation. It's not South County, it's East County, so. Anyway.
A stroke awareness lunch, so the Stroke Association of Oregon, just last Thursday was well attended. It was at the Bend Golf Country Club. There was probably about 150 or 200 people there. So stroke awareness, it's all about recovery. So stroke awareness, if somebody finds out they're having a stroke, hopefully getting medical attention as quickly as possible. Then it's a function of, is there damage, measurable damage, and obviously some people, one side of their body's not working, or other people it's just minimal. But it's all about recovery from that, and the hope and the support systems for stroke recovery. So it was a very valuable lunch for me to learn about what the options are also. And then, as I say, we did our Tumalo Community Plan kickoff. We were all there after last Wednesday's meeting.
Yes. Anything else?
We had an EDCO board meeting on Thursday morning last week, and homelessness was a major topic, and it seemed like there was a critical mass of EDCO board members that are interested in having business, economic development representation on whatever kind of advisory committee is created for the Coordinated Response Office. And also, the other thing that I attended was kind of a large community event. Commissioner DeBone was there as well. Was the growth discussion that Citizens for Community sponsored in Sisters. And Nick did a great job of presenting there, and I thought it was an excellent presentation, and there was a lot of good questions, and hopefully a lot more awareness now in Greater Sisters Country, both inside Sisters City proper and outside, about how you accomplish things like preserving small town feel, but also providing affordable housing, but also using land in a efficient and conservation-oriented kind of way. So I thought that was a great community event. Those were the big things on my schedule last week.
Oh, I did give testimony Thursday morning to the ODOT meeting regarding Connect Oregon. It ended up, there were two projects that were above the line, and they come out to 46% of the $46 million available to the 49 projects. And a project I thought we should care about in our community was the Erickson Maintenance Expansion in Madras and the North Klamath Railroad Improvement to keep 600 freight trucks off of Highway 97. They truly were minimal projects when you look at the $13.9 million for a project in Astoria and another project at the Port of Portland. So those two projects, if they still are funded, they're taking 46% of the $46 million. So I found that quite overwhelming, and I did do that testimony. So should we go to executive now? Or, Nick, did you have anything?
The only thing I would offer is a big day tomorrow with the primary day. It'll be my first day for a big election in my position, so I'll be staying late.
Oh, are you running for
and
office?
I'm not running for office. I'll be there to observe, to learn, and then to provide support to our new county clerk as well if he needs it. So.
And Nancy was
update.
actually in the hallway today, just randomly dropping off her ballot. So it was nice to see her. I think she's enjoying her new life.
And I won't be here at the county building. I'll be in southern Deschutes County tomorrow night.
Okay.